prepare all our field sterilely on the gloves. So to open your gloves, you want to always open them and then fold the bottom down. That way your package stays open. Now you use this as a sterile field. So we're going to put all the items that we're going to need to reach sterilely that we don't want to touch right away on our sterile field. So here's our suture material to suture in the catheter, our injection cap. If you were going to use a T extension port, which I'll show you how to use that too, we would put the T extension port on here also. And we need to place our catheter, and you need to remember not to touch your catheter. So you want to open it and put it directly on your sterile field. Now everything that you're going to need to use sterilely is there sterile, and then you can put your gloves on and get the items that you need without contaminating your site. You notice there's also a blade in this particular case, because when you do the donkeys you're going to need to do a cut down to be able to access the vein properly. What we're going to do here is we've prepped the area. We're going to leave it for 5 minutes, or prep for 5 minutes. Then we're going to alcohol this off. Once we've alcoholed off the area, we now need to put a lidocaine pleb on this donkey's neck because we're going to have to do a cut down. So as you can see, his jugular's right here. You see the pulsing in this particular animal. So what we want to do is make sure that we know again where we want to put our catheter. You might notice he has previous scars from catheters before. So in this case, although I would do them here, I'm going to do them just a little lower. So I want to make sure that I put my bleb right under the skin, right above where I want to do my injection, where I'm going to do my cut down over the vessel. So I want to make sure I have no blood. So I pulled back. Now I'm going to inject my bleb, and you should see it fill up like this. You have a little bleb. So about a cc or so is plenty. It's a little over a cc. Now what we're going to do is we're going to continue to prep this site for another 5 minutes because we want to do a 10-minute prep. Now we're just going to alcohol off the site again once everything's prepped. And again, as with the adult horse, you want to kind of just come on the side and alcohol off a bit so that you can get that dust kind of settled into their skin, so if they shake while you're doing your catheter, it doesn't get all over the place. Okay. Here I'm bending down, but I'm not kneeling, and I'm coming up to my donkey where I have my blab, and this is where I want to make my cut down. Now the best way to do the cut down is you want to go ahead and you're going to start with a little insert of your blade into the skin, and you want to pull the skin up and away from the animal so you don't end up cutting into some vital structures underneath. So I'm going to bring my hand around and pull his skin right where my bleb is. So I'm pulling that way out. I'm going to come with my blade and I'm going straight in. And I want to poke, guard my blade so that if anything went wrong and it went as deep as it can, I'm not going to hurt that animal. And I'm going to poke it through to the back. I feel when I get through the end of the back because the tissue's then loose and it's like I popped through something. Once I've done that, then I'm going to go and cut, extend that incision just a little bit so that now I know I've cut all the way through that skin. Okay, so now we're going to have our catheter again. Pop the catheter, take off the guard. Now we're going to sit here over the vessel, and what we want to do is again go into this hole now, right over where our vessel is. So we hold off the vessel, we go through, same thing, we're going to pop into that jugular. See the blood coming up? We're going to move it in just a little more. We're going to let go of the vessel, come here and anchor our hand on the neck, hold the stylet in place, and drive the catheter in. Now again, we're going to have to hold off pretty low because this is a long catheter, and we're in. Again, once you're done, you want to go ahead and take your sterile injection port, get that vein filled, put on your cap, and close your cap, and again, then flush your catheter. Now you're ready to suture in your catheter. So to suture our catheter, you can suture it with just using, again, this groove in the catheter, or you can use tape. I prefer the single-sided tape, so I make a butterfly only on one side. Again, I'm going to take my skin behind my catheter a little low, come out to the tape right beside the hub of the catheter, and then I'm going to incorporate the hub in my suture, again starting with a double knot. And I'll do a couple of other throws, and then my catheter's tied in.